Hey guys, this is Dr. Peter Cascio, MD, with a quick talk on ketamine for the treatment of depression and anxiety symptoms. So, as many of you may know, depression is widespread and it affects a lot of people, but clinical depression is estimated to affect 300 million people around the globe at any one time. And the conventional treatment for that is, as you might expect, conventional antidepressants along with talk therapy and other kinds of therapy. But the sad truth is only about 2/3 of people who get antidepressant therapy will actually recover. 1/3 will have sustained depression no matter what you do. And so often, for a long time, we've been looking for other solutions. So along comes ketamine. Now, ketamine is a drug that I'm very familiar with. I've been using in the ER for over 15 years and it's been around for the 60s. And it's a medication that we use to put you under, if you will, where we're going to do something very painful to you, but it doesn't actually make you stop breathing. But I've seen this both in my clinical practice as well as other people have noticed that when you give people high doses of ketamine, they have rapid, potent reductions in depressive symptoms as well as pain. However, those one-time doses aren't really sustainable. They don't produce a sustained benefit. However, in 2013, a couple of researchers were able to show that sustained dosing over time was able to actually sustain or provide a prolonged benefit for those folks. Okay. And then, interestingly enough, in 2015 to 2019, a bunch of researchers all independently showed that brief doses of ketamine can acutely reduce the risk or the thoughts of suicidal ideation. Now, that one is not sustained, but that's good to know. If you happen to know somebody who's in crisis and they have access to ketamine infusions, it might help them and get them through the immediate crisis so they can get into treatment. So the problem is obviously not everyone wants or needs to get an IV. So we've tried oral formulations and we've tried intranasal formulations. And even an intranasal formulation is actually approved in Europe along with an antidepressant. The problem is that you get decreased bioavailability. If you're swallowing it, your liver is going to take it out, and the spray, even though it's in the nasal mucosa, not much gets through to you, right? So what can we talk about IV ketamine and depression? So I would like to tell you that this is actually now widely available in the US. We do it here at my clinic, but there's other places here in the Austin area that do it as well. Just so you know, we don't give the ketamine like you would in the ER or the hospital. These are small doses. They're called non-dissociative doses, okay? And the way it works is usually, depending on what your presentation is, you're getting a series of loading doses over the course of a month to perhaps 2 months, right? And then once you reach a steady state equilibrium over time, the dosing is reduced to once a month. Now, it's not curative, of course, but we're trying to get those 1/3 of people who have chronic depression. It's not curative, and we recommend that people who do these, you do them in concert with your physician, with your psychiatrist, and your care team, because it's not a cure, but it can severely or significantly reduce your symptoms, okay? And even there was even a recent meta-analysis that came out last year, I believe, or 2020, that showed sustained benefit for these infusions over time. Other indications are anxiety, PTSD, and there's even a separate discussion for chronic pain. If you want to know more, you can Google IV ketamine for depression. You can drop me an email at drcascio@code1concierge.com. And I'd love to answer any questions you have about it. Get some help, for those of you who might be suffering or you have family members and nothing has worked. So give this therapy a consideration. It might be helpful for you, at least to get people out of the danger zone. Be well, and we'll talk to you soon.